Welcome to the Dental Handoff. I'm Dr. Kelly Tanner, and today I have with me Anne-Marie DePalma. Anne-Marie, thank you for being on today.
Thank you, Kelly, for inviting me. This is going to be a great show today. I'm here in the outside of Boston, and it's a beautiful, sunny, late summer day, so I'm enjoying my day. Hopefully, everyone is as well.
Yeah, it's that time of year where things are kind of starting to speed up, but slow down a little bit, and everybody's finishing up their vacations back at school. And I know that you're probably back on the road speaking and want to tell people all about the different topics, definitely, that you speak about. But first, I always have to ask the question, why hygiene for you? Like, why dentistry for you? Did you choose it? Did it choose you?
Yeah, I always enjoyed being involved in healthcare. So when I was a teenager, I started looking at opportunities, nursing, some sort of medical thing. And I did a stint volunteering at a local hospital. I went through their entire training program, but I ended up on the first day turning around and saying, this isn't for me. After I got on the floor, I'm like, this isn't going to work out. In the meantime, I had a general dentist whose daughter had just graduated from Dental Hygiene School, and he was involved in a lot of the dental associations. So he kind of pushed me towards dentistry and said, hey, this might be a great opportunity for you. So from there, I ended up going to Forsyth. I'm a graduate of Forsyth School for Dental Hygienists, and ended up working clinically in perio and general practices. When I was in hygiene school, though, I swore up and down that I would never work in a perio office. Never say never.
It's the truth.
Okay, because that's where I spent most of my clinical career, was in perio. But not just as a hygienist. I got to assist the doctors in perio surgery, in implant surgery. I was doing suture removals, examinations, all of those things that happen in a perio office. And I got to see a patient right from the get-go. So they would be in my hygiene chair, I would be doing my therapy, and patient would end up in the doctor's chair, and he'd flap things open. And I thinking I did a great job. No, not quite. There's the huge amount of calculus. And this was before technology and perioscopes and things like that. Everything was hand instrumentation. So I enjoyed that, but I also was looking for something else. So I ended up teaching. I had gone back and got my master's degree and ended up teaching in dental hygiene, dental assisting programs. I love the education piece, whether that's with dental hygiene, dental assisting students, or with patients. I always enjoyed that part of the clinical practice.
Yeah.
So from there, I ended up working for Patterson for a number of years as an EagleSoft trainer. So I spent a lot of time working with practices going from an old software to EagleSoft, or helping with training new team members. So there was a number of different things that I did with that. Then, unfortunately, that little thing called COVID, that happened. So like a number of different organizations and companies, Patterson had some changes. And I ended up being one of the changes. So ended up working with an AI company for a short period of time, and then did a little bit of training in an office as a training manager, creating manuals and training their team, both the administrative team and the clinical team. But all through my career, I have been doing CE programs as well as writing. So after that contract position with that company where I was a training manager, it was a small DSO in the area, that I said, I'm going to be focusing now primarily on doing CE.
Gotcha. And so that's what you do now. You're a lifelong teacher and learner, aren't you?
That's
when we got
right.
on, she's like, I'm going to meet a friend for dinner and I'm going to a CE class. And I think that's almost every time I talk to you, what you say. It's like,
Lifelong learning. That's what
how
it's
much more
important.
can fit in here, right? Why did
Sponge.
you why did you think, I'm going back, why did you think that you weren't going to work for a perio office? Like, what was your initial thought when you thought of that way back when?
I think it was part of the instructor that we had at the time
Mm,
that I really wasn't engaged in learning about perio. But then when I actually was in clinical practice and saw it and was able to understand all of the ins and outs, that it's so important in a practice to understand as a hygienist, as a dental professional, that's when my love for perio grew.
mm, that's awesome. So was that the first kind of practice that you went into, was right into perio?
No, I spent a few years in a GP practice,
Okay.
um, where I was the only hygienist, and it was the one doctor, one hygienist. I think there were two assistants and one office manager. And thinking back and looking at how that office operated, I learned a lot there. I learned a lot about working in the business side of the practice, but yet there was undercurrents of things that I just wasn't happy with. So I ended up leaving there, went to another practice for a short time, and then ended up in perio.
Hmm. In your first practice that you worked for, your GP, did they have a soft tissue management program, what they called it then? Because you remember
No.
how that, I guess it's still called that, or perio protocol, or I'm not even sure what we're naming it, but I was just curious because I remember when I started practicing that many of the offices didn't. And I would be the one to be like, okay, here's the science behind it. Here's what's possible. Here's what we talk about with the patient. Here's what to expect. Here's the procedure codes that go along with that. Was that your journey too?
No, not really. The practice as I was in, as I mentioned, was kind of an old school practice.
Mm-hmm.
So that the dentist really wasn't open to a lot of changes. And as a new graduate, I didn't want to come in and start changing everything. It wasn't until, I left that practice, went into another GP practice, and then into perio, that I got my background and I understood that, hey, this is what I need to do as a hygienist.
Gotcha. Yeah. I just wasn't sure because I knew this STM wasn't really a thing back then. And knowing your perio history, I'm just curious if it came up around that time, because how many years have you been practicing?
Many years, let's put it that way.
More than 20?
More than 20, yes. I
More
was
than
in a
20.
practice probably about 22, 25 years, yeah,
Okay.
clinical.
Yeah. So around that time, that's before AAP staging and grading.
Right.
That's before, gosh, I think we're going to look back 5-10 years from where we are now and think we really didn't even know anything then, but really then we still didn't know anything. The diabetes and the periodontal connection wasn't talked about. It wasn't written about, but you could see those patients in your chair, right?
Right. Yeah, I had one patient in the perio practice that I knew instinctively when he would come in and his gingival tissues would be inflamed and I'd be getting a lot of bleeding, and he was talking about bleeding at home, that his diabetes wasn't controlled. And then he would come back another time, 2-3 months later. I think he was actually on a 2-month recare schedule. He would
Wow.
come back in and his diabetes would be under control. And I would see a huge difference in the gingival tissue, but it wasn't as well documented. That was anecdotally. I knew what I was seeing, but the research wasn't officially there.
Yeah. So I'm putting you on the spot. Do you remember how you talked to the patient back then before the research was there? Because we still had to present what we were seeing and say, I really think there's a correlation here. Do you remember how you had that conversation?
I just remember talking to this particular patient, particularly, and saying, oh, how's your diabetes controlled, or all of that. And I hinted at there was definitely, but I didn't go into too much detail. One of the periodontists that I worked for always said he could look at a woman's tissue and tell her she was pregnant before she would even know.
Yep.
And again, prior to all of the oral systemic information coming out, these were things that we saw clinically, but we just didn't have that research behind it.
Yeah. Because I mean, when you're talking about this patient 20 years ago, or maybe it was 18 years ago, whenever that was, I'm thinking, what made him buy in to it? Because now even we have the procedure codes, we have the scientific evidence. There are still hygienists who are saying patients aren't scheduling. They're not following recommendations. And we have even more to provide them now. So I was just wondering in my mind, what's changed?
We did. We know now we have the research to back up what we say. We are now learning about verbalizing and communicating with patients and how we handle all of the patients, whether they're a patient who loves all of the data or one person who just says, just clean my teeth, yeah. Just give me all of that information.
Yeah. And it was what a cool thing that your patient who was on that 2-month interval of seeing you, like, accepted that care and trusted you.
Yeah.
Because I think that's what keeps us going so many times, isn't it? It's just like, yes, they listen to me. Someone's listening to me, that they're coming back and they're getting better and they're healing, or they're at minimum staying the same and not, conditions aren't worsening.
I haven't practiced in a while, but that's the one thing I miss is in clinical practice is that patient interaction. So beyond just talking about their oral systemic connection, there was one particular patient in one of the perio practices that I had been seeing her pretty regularly. I forget if she was on a 3-month or a 6-month recare, but she was a regular patient of mine. And she was always talkative. And this one particular time she came in, she wasn't. And I knew something wasn't quite right. So instead of starting my hygiene appointment, I literally sat her up and we started talking. And she conveyed to me that she had a son who had a substance abuse problem and that he had relapsed. And so we spent our whole appointment just talking about resources for her, for him. And I never even picked up a scaler on that appointment. And she left, and I told the periodontist I was with, and he said, don't worry, not a problem. And she came back a few weeks later and said to me, thank you for listening to me. It was all about listening. And she said, yes, I checked into some of the resources you said, and I'm so glad that you took the time to listen to me. So it's that communication, that interaction with the patient that makes clinical amazing.
If you had, I don't think we realize, I'm trying to say 10 different things, but I don't think we realize how much we aren't listening. I guess I should say that. We think that we are. We think that there is this two-way conversation, but we're always on the clock, always going, always, wondering when our next patient's going to be here. And I think sometimes we forget to listen. So have you observed that, Anne-Marie, going into practices and seeing what
it's all about the clock. It's get them in, get them out. One of the programs that I do speak on is on women's health. And I start the beginning part of that program talking about the medical history. And we just quickly look at the medical history. We don't take time to evaluate that patient and to listen to them. And oftentimes they're going to give you much more information by listening. but we're always, like you said, oh, I got to look at my clock, when's the next one? Get them in, get them out. I only have 45 minutes to an hour to do 1,000,001 things. I don't have time to listen to the patient.
Yeah.
But that's where that trust comes in and that relationship building comes in. We need that to get better patient case acceptance, bring that patient to better health.
What would you say to the hygienist who isn't even self-aware that they're not listening? Because sometimes I'm in offices consulting and I'll be listening to conversations that the hygienist or the assistant or dentist are having all the way around them with other team members and not talking or listening to the patient. Because that's just the nature of what we do. We're trying to keep people happy, trying to keep them entertained, and they don't think that the patient in front of them is listening or cares about it. But a lot of times they do. It's kind of like when I'm getting my hair done, I remember thinking that what was interesting to me, I noticed this after a period of years because I hadn't really paid attention to it, but the person who did my hair, not that we are that way, but she didn't talk to anybody else except for me. She gave me her undivided attention. And in doing that, she also was listening for what I was not saying. And so I think that's also what you're saying as well, is that we don't spend the time, we're not listening. What would you say to a hygienist or a provider to say, here's some things that you can do to kind of hone in, to adjust the dial on listening more?
Just be there for the patient. They will often tell you in words or in actions, the nonverbal side of what we do is so important as well. Someone who's sitting there closed off, that type of thing. Understanding that person's personality and where they want the conversation to go. Yes, we love having, the information and the chit chat in the office, and we need that. But yet we also need to be focused on the patient. The patient is our number one priority. Mm-hmm. If we didn't have patients, we wouldn't be in business. And dentistry is truly a business, regardless of, yes, it's healthcare. Yes, it's oral health, but it is a business. And we have to listen. You go to a store or any venue or restaurant, they're listening to you. They may not be listening to you directly, but they're looking at you. They're watching. They're observing how you act.
If you're finished with your plate, if you need a refill on water, you don't have to ask for it. It's this handoff that's going on between them and us, which, is one of the reasons why my show is called the Dental Handoff, because it's those unspoken things that happen in dentistry that we don't realize that they're so silent, but so powerful in what we're doing. So, as it relates to women's health, Anne-Marie, and you speak on a variety of different topics. So you said some of the things, so I want to hold that. I have a lot of things I want the audience to know about you, because you said kind of like your whole history. So we went from like, why did you end up at a perio office when you vowed that you wouldn't? And then you went to work into corporate. So talk about that and what that transition was like. Like, how did you find that job?
So as I mentioned, I loved education, and I had been in the academic environment for a number of years, and I enjoyed that. But there were changes that were happening there, and it's often difficult to move forward in an academic environment. So I started branching out and looking at other educational opportunities, and I just landed it. It's just so happened that in between the academic position, I ended up in a practice that had EagleSoft, and we ended up having a trainer come in. And that particular trainer, I said to her, I'm looking, I'm in between, I'm temping here, that sort of thing. And she goes, coincidentally, our other trainer just gave her notice. So I literally fell into the position.
Wow.
So.
Yeah, never, I mean, what you're saying though is so powerful too. When you're saying, talk to people, talk to other people, ask them if they know, put your feelers out there. And when you're clinical, many times it starts with the dental reps who are in your practice, right? The trainers, the folks who are coming in from other companies. Is that your experience too?
Oh yeah, huge. Networking across the board, whether it's, on social media or in person at various events, or in your practice, talking to your reps, talking to, trainers that come in, all of that. It's so important to network and for people to know about you.
Yeah. And know what your intentions are, because if you think about it, that rep is at however many offices a day, and they're gathering the information about different people's stories, and they're connectors. That's why that's one of the reasons why they do what they do, because they love to connect other people and serve you, because that's who they are. And then take that and translate into going to CE events, going to dental shows, dental meetings. That is that on steroids, because you're going to the different booths, the different exhibitors exhibiting, talking to other people inside the audience and outside in the hallways. Hey, I haven't seen you in 10 years, kind of thing. And what are you doing? And oh man, yeah. So there's such power in this connection that you're talking about, where you're talking about, in the stillness of your patient that you were mentioning. And then when you went to go make your next move, how you were connecting with what you already had in front of you, your resources. And then how did you get into speaking from here?
So like I mentioned, it has been something I have done throughout my career. But the way I started was, I'm a TMD patient. I have had temporomandibular disorders for a number of years. I have had a number of different procedures, everything from appliances and injections to even surgery. And as I was going through all of my treatments, as a hygienist, I wanted to know what was going on, what was happening to me. And what I was finding was either way above me, now I'm pretty smart, but not that smart, or way below me. And I felt, wait a minute, if I'm having a problem finding all of this information, what about the average patient or the average dental professional? Yeah. So I started speaking on it, doing my research, speaking on it, and writing. So I started writing for a number of different dental publications, even had a column in one of the dental hygiene magazines for a number of years, and still do write a number of different opportunities. So from there, from the TMD program, working in that perio practice, I understood and became more important in understanding what implants were all about, because that particular periodontist was actually bringing them into his practice. So I learned about that. Or when I had my two sons who are now adults, I talked about they have had developmental delays. They had speech and language issues. They had motor issues. So as a result, speaking with their therapists, that led me down another path. Or technology, working with technology and understanding different aspects of it, whether that be your software or artificial intelligence. And then my women's health. And I talk about, so all of my programs have come from my own experiences, whether it was TMD or implants or childhood developmental delays or whatever I'm speaking on. They have all come from experiences that I have had. And that brings me to the women's health, because as a woman, I experienced it as something that I had never heard of before, whether in medicine or in dentistry. I had never heard of basically an autoimmune condition that I developed. And that's where I talk about the medical history. And that's where I talk about conditions that we don't necessarily hear about that a number of patients, especially women, may be exhibiting. And after I started talking about it, people would come up to me, oh yeah, I heard about that, or no, I've never heard about that. So it's advancing everyone's education along the way. It's bringing me to fulfillment as an educator, because I can talk about a number of different things or write about a number of different things, and get my power out there.
Yeah. And I think the other power too that comes from that is, of course, you're sharing, you're connecting the dots for other people. And then someone in the audience may say, oh my gosh, I think my sister might have that. Or my mom might have that. And that's crazy. And that's the power of the ripple effect that we have on people, that we have with people. And, you know, taking it back to your personal experiences, Anne-Marie, I think what's powerful about what you have stepped into in your career is that you stepped in it, and many people could just experience it and take it in that way and be like, okay, well, that was my experience. Many people don't take it the next step to, okay, that's mine, and it's my responsibility to share it. So I feel like that's where you have been, because it could have just stopped with you.
Right. You know, so for example, not only the women's health, but like the developmental delay program. I talk about speech and language and motor delays. And yes, I've never worked in a pedo practice. I don't see kids, you know, but I see aunts, uncles, parents, grandparents, all of that. And people who are involved in children's lives so that they can recognize some of these signs and symptoms. And I've had so many people come up after I've given that course and say, oh yeah, I see this in my daughter, son, granddaughter, niece, nephew, all of that, as well as in the patients that we see.
Yeah. So powerful because there's so many things that we have been looking at, and it's a variation of normal, right? And we haven't had a label or something to call it, but we notice that something's different. And so when something's different, even things that we can outwardly see, there's things that we should know, because if it's something that we can see, it's certainly affecting that patient in ways that we're not realizing. So could it be dry mouth? Could it be other social limitations that they have to get the help they need, to ask the question, to know how to communicate with their care providers? It goes on and on. And so it sounds like that a thread of your career has been about communicating, learning, communicating, connecting other people with information that started from your patients, and you having that curiosity to also learn and say, oh, I want to learn more about perio and implants. And then taking that to say, I'm going to do a program on this because so many people don't know about that, and you're passionate about it. So tell the audience about the other courses that you teach as well, because you have a wide variety of them.
So the TMD, the developmental delays, the artificial intelligence, and even a little bit on cybersecurity, again, bringing that technology piece in. The women's health, I call it under the radar women's health. There are a number of women's health programs out there that, talk about hormones and all of that. Yes, I do include that, but these are conditions that we don't necessarily see. And then documentation and there's so many. My repertoire is so different and so
So eclectic, yeah.
Exactly.
That word. Yeah, but it's this cobbling of all of your life experiences. But when you think about it, you could have a combination of any of these experiences, and they're not one-off. They're not just singled out over here. They could be combined all in one patient, or and that's what I find fascinating about what you do.
Yeah. For example, TMD and women's health, there is an overlapping area to that. So there's so many, even though they're so different, there are so many similarities between the courses.
Yeah.
And it all comes down to, like I said, my passions and my experiences that I want to educate others about.
Yeah. You, and you continue to prove that because you're that person who just wants to go and plug in their brain to learn all they can to say, okay, how does that fit in? And your curiosity is what is carrying you. And that I think also too, we've said on the show to the audience, keep that open mind, because when we keep an open mind, that's when we can learn. That's when we hold space for considering another option than what we're already doing. It's when we're closed down that we think that we know things that it doesn't go very far for very long.
That's right. Yeah. We need to be open to learning, to new experiences. Yes, I've had some good experiences in dentistry and some not so good experiences, like we all have. The career in dental hygiene and in dentistry is not just one, upshot. It has its peaks and valleys to it. But through all of that, finding what your passion is in dentistry, and going back to your original question, why did I get into dentistry? Find out why you did. Yes, money is great. We all need money. But what else is feeding you?
What fuels you every day? Mm-hmm. What feeds your soul? Then there's days that it's just flat. They're like, and there's gifts in those days too, because they're not either.
Right.
And you could take those good old fashioned kind of boring days, but lean into your curiosity, you guys, and certainly check out Anne-Marie's programs. She's speaking everywhere, and she's a Rare Bird speaker as well. So you can check her out on rarebirdspeakers.com. And Anne-Marie, any other final words that you would like to say to the audience?
Just basically be curious, follow your passion, be open, all of that.
Yeah. Well, if you guys want to get in touch with Anne-Marie, her contact information is in the show notes. There's different ways to reach out to her. And Anne-Marie, thank you so much for your time today. This has flown.
Thank you, Kelly. And thank you, everyone, for joining today. Have a great rest of your day.
Yeah, thank you. And for all my listeners, I always ask if you don't mind going over to the Apple app and going over to Apple Podcasts to give the Dental Handoff 5 stars, a 5-star rating. And then if you're watching this on YouTube, go ahead and press the like, subscribe, and then share so the algorithm knows that you love it. And it also recommends it to other people who you love too. And we will see you next week, my friends. Thank you all for what you do to touch the lives that you do. And we will see you soon. Be well, my friends.